Okay, we already assessed her swallowing. Do you need another drink of water? No? Okay. Do you prefer to take them all at once or one at a time? All at once. So we'll hand them to her. She takes them, drinks water, and you're going to assess that she drank enough water to safely swallow all the pills without any difficulty. Any problem with that, ma'am? No. Now you need your ink pen. You're going to go ahead and by the 0700 time for the diabetic, put your initials, put a slash so that your instructor can sign behind you. You put your initials with SN or HCC, whichever one you want to put, but make sure you identify that you're a student nurse. The VuMax was next. We had to have a blood pressure reading to give this, so here we will also add our initials and 130/60. So we know that we gave both those medications. Okay, done with that. Okay, next I choose to do the patch, or you could do the carrot bait. Let's do the carrot bait, because she's taking all her medicine. All right, the suspension PO daily. Did I forget to identify my patient when I came in the room? Yes. So you might want to say, I didn't identify my patient. So let's do that anyway, and you're just going to imagine that I did it. Miss Culver, could you state your name, please? Your birthday, 8/12/59, and you make sure your medical record matches. 479-62134. And what are you allergic to? Bactrim, and it causes a rash? Okay. Sorry about that, students. Okay. We're going to pretend we started over. All right, we did that. Now comes the carrot bait. Okay? Drink it down. Now you can't drink any water for the next 15 to 30 minutes, okay? To let that have its action that it needs to on your esophagus, and she understands that. All right, now you take your MAR and again initial that you gave the carrot bait as ordered. Next, we're ready for the carrot crest patch. We noted that we're going to put it on the left upper chest. Okay. Open this and take out your little disc. Take a Sharpie or a good ink pen and initial it and put the date and the time. So if anybody was to want to know about it when she was in bed, they could easily see when it was put on. Okay, you're going to gently pull this off and put it against her. Now, if you are concerned that you might get medicine on you and it would cause a systemic effect, certainly okay to say, I'm putting on gloves. Peel this off gently, again, keeping the medication side against the patient and away from you. Put your hand on it for about 30 seconds, just so the warmth of your hand can secure the edges and the medication will be intact with the skin, but don't massage it or rub it. Okay, we have that on. Come back, document again that you gave it. Okay, next we have got her knees, because we're going to do the ears last. Okay, gloves on. Okay, ma'am, I'm just going to spread this over this small area on your knee. Okay, so we're going to spread it on there. Okay, and spread it on there with another side of the swab. All right, and just leave that on there and let it absorb, ma'am. It does look much better. Okay, now because I was down there around the knees, I'm going to take off the gloves, wash my hands at the bedside sink, put on another pair of gloves, go over to the right side of the bed here to her ear, bring my MAR. The order says that I am to administer 2 drops of the suspension. So it's a suspension. When you see that, shake it. She's an adult, so I'm going to pull her ear up and back. I'm going to have her turn her head to the left side. We're going to pretend that I have pulled the medicine up. All right. Up and back, and position over the canal of the ear, sort of to the side a little bit, and drop 2 drops and let that slide down in there. Don't put it directly on the tympanic membrane. Immediately take your finger and massage the tragus to help facilitate the medication going into the ear canal. Ma'am, I need you to stay on your side for 15 minutes and let that medicine take effect. If you have an order for a cotton ball to be placed at this time, you would do so, but I do not have an order for a cotton ball. And now I would document again that I gave the eardrops. Initials, HCC, and a forward slash so my instructor can sign behind me. Ma'am, is there anything else that you need at this time? No. So you're aware that you need to stay on your side? Yes. Okay, put the bed back down in a low position for safety's sake. Make sure the call light is within reach. and you can call me for anything. Okay, ma'am? And I will be back. So, now, you got to take back your eardrops, of course, and your MAR. Okay? Unlock the cart. Put the eardrops back in, and then you're done with that part of it. The rest will be thrown away, but we're going to save it since it's be practicing for you on another time. So I'll put this back in. Now we're going to pretend that we have another patient so that you know how to administer nasal drops. Okay? So let's do eye drops first. Okay. So again, check your orders, do your 3 checks. Make sure that you have the right medication, it's the right time, it's the right patient. You clarified your doctor's orders. You are to put in 2 drops in the left eye. Okay? So we've already assessed the client, ascertained that she had some dried matter, put on gloves, clean the eye with a washcloth. Alright, now we're in the room with the MAR. We've identified our client per the criteria that we've already established. We've introduced ourselves. Ma'am, I'm here to put some eye drops in your right eye. And this does not say shake, so you don't have to shake it. Leave the cap where the inside is not touching the now we're going to put her back on her back. We're going to pretend it's been a while. Ma'am, I'm just going to pull down gently here. I want you to look up at the ceiling. I would take away her pillow very carefully. There we go. You're going to take your thumb here and pull down to expose the conjunctiva, and this thumb pulls up to keep her from blinking and displacing the medication. You'll go to the middle of the eye where the conjunctiva is located and do 1, 2 drops. Then immediately put your finger here over the lacrimal duct to keep it from going systemic. Keep it there for about 15 to 20 seconds. She should have a tissue handy if she needs it for any excess tearing. She doesn't have any, so you're okay with that. Okay, any problem with that, ma'am? She says no. So immediately recap your drops. These are expensive. Take your ink pen out and document that you gave the eye drops. Okay, and you know how to document. All right, now we're going to pretend that we have gone back to our cart. We have another patient. And I have misplaced my handout. Here it is. I want to make sure that I tell you exactly what you're supposed to do with the nasal drops. I know what you're supposed to do, but let's do it. Come back in, knock, wash your hands, identified your client per the identifiers that we've established. Ma'am, I have got a nasal spray for you. Okay. So again, you could lay her down a little bit more or take away the pillow. And this happens to be Rhinocort. So take that off. Now, since it's a spray, you're going to have to ask her to occlude her right nostril. She's supposed to get 1 spray each nostril. And so we're going to say she's not able to, so we're going to occlude the right nostril. You're going to go inside the nair just a little bit, right in the center, pointing towards the ethmoid bone. Don't touch the nair, and then you'll go. As I spray, I want you to take a deep breath in with each spray. So if it's 1 spray, 1, or if it's 2, 2, but squirt, and she takes a deep breath in. Squirt, she takes a deep breath in. Then repeat it on the other side. Occlude that nostril. Get inside, just inside the nair. It's hard to do it on this dummy without touching, but state that you would not touch. I want you to take a deep breath in when I squirt, okay? 1 spray, squirt, take a deep breath in, squirt, take a brief breath in. So it should happen simultaneously. Okay. And then don't blow your nose, man, for at least 15 minutes, okay, to let that medication take effect, and then it's okay. All right. And just stay in the position you're in right now for 15 minutes. Do you need anything? No. Bed's in low position, call lights in reach. Wash my hands after I put my cap back on. Left the room. All right, left the room, came back. Now we have got nasal drops. They are different, okay? With the nasal drops, we verified our client, we verified the medication. She's going to get 1 drop in each nares. Take the cap off very carefully. Okay, ma'am. Now on this one, you're going to take away the pillow again. And here, you don't have to have her occlude her nostrils because these are drops. So you might want to tilt the head back just a little bit and get right in the center again, just inside, 1 drop, and let it slide down if it's 1 or 2. Other nose, repeat. Don't blow your nose for about 15 minutes, okay? And some books say 5 minutes, so look at your guide. Once you've done this, you want to put your lid back on, document that you administered this medication with your initials, and then SN RHCC, instructor will sign behind that after a /. Wash your hands, go back to your cart. You're going to have to unlock it and put your medications back up, and you have finished this skill successfully.